Hello, I'm Dr. Saroja, specialist in physical medicine and rehabilitation at Akkineni hospitals. Wishing you good health. Today, we'll review some important points. Please stay engaged and take notes.
Welcome to today's Explainer. Look, if you're or someone you love has ever been told that your joint pain is just, an inevitable part of getting older, well, you're going to want to pay close attention. Today, we're tearing down those outdated myths about osteoarthritis, and we're replacing them with some incredibly empowering, science-backed realities. Here's our roadmap for today. We're going to rethink osteoarthritis, look inside the aching joint, identify the symptoms, and then explore the true power of physiotherapy. After that, we'll cover tools for comprehensive management, and finally, how to reclaim your active life. Let's get right to it.
Section 1. Rethinking Osteoarthritis, the Paradigm Shift. To truly grasp how we manage this condition today, we first need to zoom out and look at the sheer, massive, global scale of the issue. 500 million. That is the number of people globally who currently suffer from osteoarthritis. Think about that. So if your knees, your hips, or your hands are aching, you are absolutely not alone in this fight. It is literally the most common joint disease on the planet.
Now, we need to completely destroy this old view that osteoarthritis is just some inevitable, simple wear and tear condition. Like a mechanical hinge just given out over time. Scratch that. The modern view, which is established by current clinical research, is that OA is a treatable, highly complex biological and inflammatory process. It's not passive decay, it's an active process, which means we can directly intervene in it.
Section 2. Inside the aching joint, the vicious cycle. So if this is an active process, what is actually happening in there? Well, when we look at the physiological cascade of OA, there's this vicious cycle driven by 4 interconnected changes. First up, cartilage degeneration. The smooth tissue covering the joint thins out, gets brittle, and its shock-absorbing capacity drops. Second, bone changes. The bone underneath actually reacts by getting denser and forming osteophytes, basically bone spurs, that totally alter your joint mechanics. Third is the inflammatory component. Chronic low-grade inflammation literally changes the fluid right inside your joint and drives even more degradation. And fourth, muscle changes. Because the cartilage loss and chronic inflammation, they work together to continually and severely stress the joint.
And this cycle actually explains something huge. It explains why your muscles feel so incredibly weak when your joints hurt. It's this wild phenomenon called reflex inhibition. Basically, your nervous system is literally suppressing muscle activation because of the pain. Your brain is trying to protect you. It's saying, whoa, don't fire that muscle. But this neurological reaction creates a terrible cycle. Your muscles get weaker, they provide far less support for the joint, which leads to more mechanical stress, and, you guessed it, more pain.
Section 3. Identifying the symptoms, listening to your body.
Okay, understanding that macroscopic breakdown is really only half the battle. So how does all this actually feel? How does it present itself physically? There are 3 hallmark symptoms to watch out for. First is a mechanical pain pattern. This is pain that flares up when you're physically active and calms down when you rest. Second is morning stiffness. This is super common, especially if you wake up feeling incredibly stiff for about 15 to 30 minutes before things kind of loosen up. And third, joint swelling and crepitus. Crepitus is just a fancy word for that gritty, grinding sensation you might feel. Now, these symptoms most frequently hit the hands in your large weight-bearing joints, like hips and knees, making everyday stuff like walking, climbing stairs, or even just getting out of a chair a real challenge.
Section 4. The power of physiotherapy, the virtuous cycle.
Now, right here is a single, totally life-changing concept we have to grasp. Pain doesn't indicate tissue damage, and appropriate activity actually benefits joints. Look, when we hurt, our totally natural instinct is to just stop moving out of fear, right? But understanding this quote helps us break that vicious cycle of reflex inhibition we just talked about, and it kickstarts a virtuous cycle of healing. Movement isn't damaging your joints further. Literally, movement is medicine.
There are 2 absolute powerhouses of physiotherapy that serve completely different but beautifully complementary purposes for protecting your joints. First, resistance training. This uses progressive loading to strengthen the specific muscles surrounding your affected joints. It provides vital mechanical support and directly reduces joint stress. And when done properly, it absolutely does not worsen OA. Then, on the flip side, we have aerobic exercise. Think low-impact activities here, like cycling or swimming. These provide huge benefits by supporting your cardiovascular health, and they have actually been proven to directly reduce pain. And when we talk about reducing joint stress, the data here is just staggering. 5 to 10%. Research shows that for every single kilogram of weight you lose, you reduce your knee osteoarthritis pain by 5 to 10%. Think about the leverage there. Just a seemingly small drop in overall body weight takes this immense mechanical load right off those joints. It substantially improves your symptoms and actually slows down the progression of the disease.
Section 5. Tools for Comprehensive Management, Bridging the Gap. Now you might be sitting there wondering, okay, but how on earth do I exercise and lose weight if I'm currently in way too much pain to even get moving? Honestly, that is a perfectly valid question. If you're in too much pain to exercise, there's a whole menu of adjunct therapies designed specifically to bridge the gap. Manual therapy can give you some temporary pain relief just to help you move. Assistive devices like canes, proper footwear, or knee braces, these safely reduce joint loading so you can stay active. And no, using them is absolutely not a failure. Then there are injections like corticosteroids or hyaluronic acid, which can give you a really nice pain-free window. We're framing all of these not as magic bullets that just cure the disease, but as functional bridges to enable your physical therapy. And hey, notice surgery sitting right there at the very bottom? That's because it's a last resort for severe, disabling cases. It is not the first step in your journey.
Section 6. Reclaiming your active life, a positive prognosis.
Today, we are shifting the ultimate goalpost. We're moving away from the impossible expectation of eliminating all pain forever and moving toward the very real, very achievable goal of reclaiming an active, functional life. And the rehabilitation timeline is highly encouraging. In week 1, you start a consistent, tailored exercise program. Yeah, it might be kind of challenging at first, but usually by week 4, you start to notice some typical pain reduction. By week 6, you're experiencing substantial pain relief and increased physical function. Like, you will literally find yourself doing more, even if a little baseline pain remains. In long term, you actively slow the disease progression and dramatically improve your quality of life. Seriously, most folks see tangible pain reduction within just 4 to 6 weeks of consistent effort.
As we wrap up today's explainer, I want to leave you with this somewhat provocative thought. If pain doesn't equal damage, what are you going to choose to do today? Are you going to let that outdated wear and tear myth keep you trapped on the couch? Or are you going to use this knowledge, overcome that fear avoidance, and take active control of your life? The science is incredibly clear on this. Your joints absolutely thrive on movement. So get out there, find an evidence-based physiotherapist, and start your virtuous cycle. Thank you so much for learning with me today on this explainer, and I'll catch you next time.